about the other client
Okay.
that you had mentioned.
Hmm.
Yeah, so there was about the difference of energy in the
Hmm.
right side and the left side,
Hmm.
and a sense that she's very stressed out. She experienced her stress from the right side,
Yes.
and that, in a way, holding the ball and shifting from one hand to the other made her able to recognize this more, but also to release some of the energy.
Hmm.
So, do you want to describe a little bit more, how that happens, what you notice when that happens, or what she reports, what you notice, about the, in what way it works?
Yeah. So, again, when we first started using this, there was a bit of resistance to it. The thing about the right side of her body is this client has a very long history of sexual abuse. And the abuser is someone who is very, very close to her, who is a family member. And so the right side of her body, that I guess she sort of developed this association with that abuse because this person would, abuse her and then would sleep beside her
Hmm.
and would stay there. And that was always the side that this person would sleep on. And, just the abuse has continued for many, many years. And was going on, and she's into her 40s now, and was going on up until very, very recently when she kind of said no more. So what happened with that was that when she would hold the ball in her left hand, it was okay. When there was nothing would come up for her. But the first time that she tried to put the ball in her right hand, it was almost like she experienced an electric shock.
Hmm.
She just had this kind of jumping, and she, wanted to throw the ball. And she said, I don't want to do this. Do I, can I get rid of it? I don't want to hold this. And I said, that's fine, go ahead and just set it down gently. And then after she set the ball down, I asked her to just pay attention to what the feeling was like of just releasing the ball. And she said that she felt a very, very strong uh, sort of like awakening in parts of her body that she doesn't normally feel except as pain. What she normally experiences on the right side of her body is a lot of stress and tension and pain in her, shoulders and her pelvic area and her hip and her knee. And this pain is kind of chronic for her. And she's never had any diagnosis of any, sort of physical thing that's going on. So she's aware of the fact that it's, psychological, or, it's related to, something that it's not disease oriented.
Right, right.
And so what we started working on was to just become aware, not of the highest point of energy, because that was very activating for her, but what is the lowest energy that you're feeling on the right side of your body right now, and where are you feeling it? And it was just a very, very she called it kind of like I don't remember the word exactly that she used, but like a vibration sort of in her pelvic area on the right side. And that it was kind of just, sort of radiating out. So
And so,
that
when you were doing this, when you're talking about this, you're talking about without the ball, just in a regular way, or when touching the ball?
this is after she set the ball down, and I just
Okay,
asked her to get in touch with the lowest energy and
okay.
on the right side of her body. Um, for her, I think releasing the ball was, it was just very, I don't have to feel this anymore,
Okay,
because I
so
think
she was holding it, kind of squeezing it, and
she was just holding it,
just
actually.
holding it, not even squeezing
Yes,
it, but holding it, and the
yes,
holding it brought all this pain.
yes. It
And
brought it
when
all up. Yes.
and when you suggested you can release it,
Hmm.
she felt a sense of literally release of her, not just releasing the ball in a sense of it's neutral, I'm releasing the ball, but she felt an inner release of a lot of that
Yes.
tension.
Right.
And then as she was staying, the ball now set aside,
Hmm.
you in a way, titrated the intensity and went to,
Yes.
okay, what's, the amount of intensity you can tolerate,
Hmm.
and stayed with it.
Yes.
Okay. And
Right.
then she felt that there was something radiating from the hip.
Right.
Okay.
Exactly. And that, that was the lowest, yeah, the lowest kind of level of intense pain on that side of her body at that moment. Um, the thing about this client that I guess I didn't think about it in the moment of doing that ball activity, which, at the end of the day, it was very, very helpful for her, but maybe it was too much too soon for her because, this is a client who is very, very dissociative. And even during, our therapy session, she's normally really not present. She's kind of up in the ceiling, around the walls, just kind of all over the map, and very difficult to even have a back and forth conversation with her because it's just very choppy and very she's just not really present.
Mm-hmm, mm-hmm, mm-hmm.
She's just kind of all over the place, and I think that the severity of her abuse was just so high that it's just easier for her not to be present.
Mm-hmm, mm-hmm.
Because when she does become present, things come up for her like, oh, this voice is telling me, this, that man is telling me, there are all of these characters that have sort of been embedded into her existence, into her daily existence, that were embedded there to threaten her about, you don't want to tell any of the secrets, you don't want to, or else kind of thing. And so
Mm.
that all comes up for her when any presencing happens, when any awareness comes in, this comes up for her very, very strongly. And so we've been using active pause, we've been using breathing, and just sort of, anchoring a safe place to just sort of get her in touch with the idea that her body is a safe place. It's
Mm-hmm,
not just a place to be violated,
mm-hmm.
because that was kind of her belief, of course, that my body is not safe, I can't trust it, it doesn't protect me, it's been violated over and over, and it's helpless. It just kind of, just takes it lying down, literally. And so it's been helpful to use active pause and a couple of other things to just do very gentle awareness of how the body is a safe place.
Yeah, so I wanted to check something in what you said to see if I hear you correctly. So, one is that sense of things like breathing or other body related approaches help her connect with the idea that the body is a safe place as
Yeah.
opposed to the gateway through which she's engulfed in pain.
Yes.
What you also said, I think, is that there was something, a release when she was releasing the ball.
Hmm.
And I'm wondering whether what this is about is, in a way, a sense of connecting with the idea that she can do something to interact with the pain. That the body is not just a passive recipient
Hmm.
of torture, but
Right.
that she also has, like not is not disempowered by it. I'm just wondering if that corresponds to the experience you had with her or not.
I hadn't even thought about it like that. I really hadn't. So it very possibly could be. I didn't even check that
Mm-hmm.
with her. Um, it might have been that. It might have been something else. I really didn't. So I cannot speak to that particular
Okay.
point. Yeah. I just know that in the act of releasing the ball, there was a release for her. I don't know if it was the release of the pressure that she felt when the ball was there, that, oh, I'm feeling something and it's overwhelming, to feel that. I don't know if that was the release for her or if there was a release of the actual physical pain that she was feeling. And because I wanted for her to stay connected
Mm-hmm.
and not to lose, her connection, I didn't want her to engage with the most highly energetic part of herself, but with the place of lowest energy, so that
Mm-hmm.
it would not overwhelm her. And she was able to do that. And for her, the experience was a radiation and not a pain anymore. It was more like there's an energy flow there coming from that area.
Right,
So
right.
I know that.
Yeah, so that's what made me think of it, because in a way, you could say, as this was an experience in titrating,
Hmm.
oh, if you do this, it's intense. So now what happens when you do less, and can you stay with less? Oh, actually, yeah. So in a way, I can control my engagement,
Yes. Yeah.
that,
That makes sense. I didn't even
yeah.
think of
No,
that.
I mean, just from the outside, that's a
Yeah.
hypothesis.
Yeah. Yeah.
Great. So that feels really nice. That feels really nice. Um, in a way, in this case also, there's something about that you're integrating the approach with that general sense of what you're doing with her.
Right.